In general, as a society, we don't talk very openly about death and dying, and that can have consequences for patients in a number of different ways. Firstly, if we don't talk about it, it doesn't become a priority for the government, for the Department of Health, for the NHS. But equally, at an individual level, if we don't talk about it, how can we make sure our loved ones' preferences are met if we don't really know what those are? Today we had a lot of really fascinating talks at a symposium, really setting out what we do know about this and what we don't know about this. And we heard from Jane Seymour, for example, who has reviewed the whole literature on attitudes towards death and dying and all the surveys that have been done. And in general, people are reluctant to talk about it, and many of them have not discussed it with their loved ones. But we also heard about the new national coalition that's called Dying Matters, which is trying to raise the profile of discussion about end-of-life issues with the public. I think this is a priority for the NCRI, first of all because a quarter of the population will die of cancer, but across all disease areas we need greater openness about this if we are to be able to give the best care to our patients. And to do that we really need to understand what people do want, and that's where research comes in. The systematic review that was presented today shows what we do know, but it also shows what we don't know about this area. And I think it will highlight the gaps in our knowledge. And I think when we can see the systematic review in full, what we will probably see is that there is a need for a lot more qualitative research, talking in depth to focus groups, to individuals, to find out what their attitudes are and what might stop them talking about death and dying more openly. If we don't talk about it, I think it's very unlikely that we can get the services there to be as good as they need to be for patients, and also so that we can meet the preferences of individual people as they approach the end of life.